Hello everyone, my name is Dr. Shashikiran. I'm a surgical gastroenterologist with 5 years experience in the field, and I have been working with Medfin from past 2 years. So as the name implies, GERD is gastroesophageal reflux disease. So basically what's happening is the stomach contents are refluxing into the esophagus that normally does not happen in a patient. So why is this happening? So anatomically speaking, there is a valve-like structure at the junction of the esophagus. Esophagus is the food pipe and the stomach. So basically the contents we have it. So it goes through the esophagus into the stomach, but this valve normally prevents the stomach contents to come up. So normally the esophagus, stomach, and it should go down into the small bowel and then the large bowel. So what happens in gastroesophageal reflux disease is this valve function is gone. So the valve is not unidirectional now. So the contents in the stomach can reflux back into the esophagus. That normally doesn't happen if the valve were to be normal. So the stomach contents are going up the esophagus. So as we all know, stomach produces acid for food digestion. So along with the food contents, even the acid is coming up the esophagus. So this is the classical gastroesophageal reflux disease. GERD is one of the most common presentations. Also the number of patients presenting with GERD has increased nowadays. So the reason being obesity, the kind of lifestyle we are adopting. So initially GERD was very common in the Western population, and Indian population it was actually less. So nowadays we have started adopting the Western lifestyle, like sedentary lifestyle, having fried fatty food, increase in weight, obesity, and so all these are contributing to an increase in the incidence of the gastroesophageal reflux disease.